All right, so we are going to bring tonight's Board of Health meeting to order, and I'll start the meeting with the chairman's general announcement. The Board of Health is recording. Is anybody else recording? Okay. And tonight's meeting is being held virtually through a Zoom webinar pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law. So first item on the agenda tonight is approving the minutes of the previous meeting. So the first one of those is February 10th. Any additions, changes, or anything to add to the February 10th minutes?
No, they looked good.
Great.
I motion to approve the minutes as written.
All right, I can second that. And so roll call vote, Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
Great. We have two additional sets of minutes to approve. The first of those is the open meeting aspect of the February 15th meeting. Do we have a motion to approve, or do we have any changes or adjustments?
No changes or adjustments.
I motion to approve those.
Okay.
I'll second that.
Oh. All right, so motion and second to approve the February 15th open meeting component as written. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
Rebecca Torsha?
Aye.
And then the last of those is the minutes of the February 15th executive session. Any changes or adjustments to those?
Look good.
Okay. Do we have a motion to approve those as written?
A motion to approve them.
Great.
I can second them.
Okay. Vote to approve those as written. Christine Johnston, aye. Dr. Katie Jobbins?
Aye.
And Rebecca Torsha?
Aye.
All right. Anyone here for public comment?
No, it doesn't look like any attendees.
See me either. So. All right. If no one is here for public comment, we have three things under business at hand. So Tammy or Alex or Renee, whoever is sharing with us the update from Liz on the trash and recycling update.
Okay. Let's see. I had Liz put together a very comprehensive list of everything that's been going on in trash and recycling because I feel like there's been so much going on lately. I will start with on Friday we had our Fix-It clinic at the senior center. It went really well. I just thought it was so nice. Like the people who showed up, they brought some, it could have just been simple things like irons and TVs and stuff. But then there were people who brought like antique chairs and everything like that. And it really went nice. And it was a great way to, put love into the things you already have instead of putting them into the landfill. So I thought that was really great. And let's see. If you haven't been there to donate books yet, there's also the new book bin outside of the Council on Aging. I've already brought a couple books there. It's just way in the back of the parking lot. Just go around, pull your car up. It's right there. Let's see. We're getting ready to transition to our new waste hauler, Casella. That means that routes are getting made. They're ordering containers and just working on the transition. There will also be a new calendar and a guide, which will be adding a Spanish option too for that. Liz is working on applying for the 2022 Recycling Dividends Program grant. It includes more steps such as adding more organics, diversity, and equity in recycling programs, which is where it comes in having Spanish on the calendar and the guide. There will be a food waste workshop on May 9th to help businesses in town learn about the upcoming change to the food waste ban, which brings it down to 0.5 ton per week. And then we'll need to either reduce or compost. Let's see, April 23rd, we're working on for the Earth Day cleanup. I think that's already up on the website to sign up. So if everybody's interested, we can go into Facebook or to our town website. There will also be a June 25th recycling event with Mass Saves and Eversource at the high school. Right now, Renee has been going through ordering compost bins and rain barrels for the spring. We're finding out supply chain and resources have made it interesting, change in pricing. Let's see, the air sensors, I think they're still getting calibrated. They're monitoring air pollution that they're coming through, and we might actually get some additional air sensors that measure some other pollutants to tack on with that now that we've joined in with the Pioneer Valley, I think it's an air pollution collaborative. We're switching from Simple Recycling textile company to BBBS in Heart Springs, or the it's the Boys and Girls Club and CMRK. Is that what it is, Alex?
Yep. Yeah, it's CMRK, and then they partner with the Boys and Girls.
And for our textile pickup, and that will change over on April 19th. We're sending out haulers permits and following up. Still having a hard time getting to people who haven't applied in the past. So we're trying to get everybody all set with the getting permitted and getting in compliance with the state regs. One of the things that I'd like to do over the summer is sort of revisit the permitting structure we have. Right now, the permitting structure is just basically one fee for any type of hauler, but more to put a different structure. Obviously, Casella has a lot more trucks, and they do a lot more business. They will be doing a lot more business in town, as say maybe somebody that comes to your house and cleans it out for you might come to the town maybe a couple times a year. So trying to find more equitable fee structure for that. And also, so big news was today, we had a meeting with CEP in Springfield and FNG. So CEP, which is the incinerator that takes the trash, they went into bankruptcy last year. I feel like I have so many notes for the meeting. They went to bankruptcy last year, and they are selling it to FNG, which is a company out of Enfield. And they will be, so their bankruptcy hearing will be on April 14th, and sometime afterwards, FNG is taking over. They'll be closing on the company. Until then, until April 14th, not much will be changing, but effectively after the ownership changes, they'll be severing the contracts, and then people will be putting new contracts with FNG. But the difference is that they will no longer be incinerating there. They will be transitioning it to a full-time, what's the word I'm looking for? Transfer station. The transition to a transfer station. And because of that, we will be expected to, it'll be pricier, basically. Like they can't give any estimates yet as for towns. So that's something that we'll have to be working with them. Also, talking with Casella to see, if they partner typically with anybody. So it's possible that we might be going to that direction, but also the incinerator generates energy as well. So that's a lot of different things coming on, because a lot of towns bring their waste there. So we'll be keeping you posted as to how that goes. Any questions?
When does the new contract with Casella start? I'm sure everyone in town is curious.
It goes for the new fiscal year,
Okay.
right? So July 1st, or is it? Yeah, I'm pretty sure July 1st. It's very interesting. I know I've listened to what everybody has to say on the websites and the forums, and I guess what we will also remind everybody is patience with the new company too, because we'll have to take into account that this town is brand new. But I believe Liz said that they've already been driving through town trying to get the routes done and everything. So fingers are crossed. There's no shortage of phone calls, right, Renee? Nope. Okay. So I feel like I need confetti. Then for the next one, as I don't know what order I put it on my agenda. I wrote down a report, and then I might not have had it. Is health needs assessment next?
Yes.
Okay. So as of today, our online health needs assessment survey is live. So we'll be sending you ladies all the links. You can get it on Facebook and on our website. But I've been trying to also put up posters everywhere. It's nice. It's comprehensive. It probably takes maybe 10 minutes, you think? Something like that. And it just hopefully that, so it'll be live for 4 to 6 weeks. And so hopefully we'll get a lot of great information, especially if we get as many people as possible to come in to take it. So we'll be going through the online portion, and then we'll also be moving towards the focus groups after this. So I might be pegging people's brains to see if they have some people who would be interested in the focus groups. So I'm probably on. Yeah, okay, I am on. I'm on mirror view, so it would make no sense to put this paper up. So anybody who enters into the survey after the survey can also enter to win a $100 gift card. And we're doing four gift cards for that. And then for the focus groups, we're going to do 3 focus groups with 3 to 5 individuals per each focus group. And we're going to do a $25 gift card for those groups as well. And just kind of depending on the groups, I guess, it might be a different gift card. But I think ideally from the original plans of the survey, we were looking to kind of do different ends of the demographics, like maybe a senior focus group, and then maybe more on the younger parent family sort of side focus group for the survey. So keep that in mind.
What language is the survey in?
It's in English.
Written any other languages?
If no, unless they want to get a paper copy. But the thing is that the health, oh my gosh, HRA, they prefer analyzing the data from the online survey over the paper survey.
Okay.
Yeah.
I just think about I'm so excited about it. I think it's awesome. I just want to make sure like we're being mindful in the future about, thinking about not including our whole population, and that recognizing English might not be, although people may speak it well, it might be not their preferred language for reading or writing. I'm just trying to maybe think about other options in the future about how we can be more inclusive for that.
Yeah, well, with this grant, we just eked in under the how much money we had on the grant.
No, and that's totally fine.
Yeah.
It was more I'm
$5. But
Yeah.
the good thing is the survey's ours now. So
Oh.
if we want to modify the survey, if we get more money to go through translation portions, because there's 2 parts to that. There's translating, but there's also taking that information and filtering it out and figuring out what it means. So yes, exactly. There is a portion on the survey that talks about the language that is spoken in your household. So hopefully that will inform our future surveys going forward as well.
I'm just asking just because I don't know much about the survey itself. Do we know what grade level it's written for? Just to also think about that too.
Grade level, I'd say, there's some pretty comprehensive questions about your own healthcare and, civic engagement. So it's definitely something that's more aimed towards adults, caregivers, family members.
It's just something I've really been kind of paying attention to since COVID. I've realized how low, much lower than I would expect people's health literacy is. And so sometimes these questions can be slightly overwhelming. And Christine can probably speak about this more from like her MPH expertise and what she does. But it's just something I've been really kind of paying attention to and making sure that we're trying to meet people where they are and not where we think they should be. And I like I said, I'm super excited about it. I just want us to kind of have these conversations when we're going through this as well too.
Yeah. Well, I mean, health resources in action. This is, I guess this is their jam, their bread and butter. This is what they do. They're pretty, the questions are pretty straightforward.
Okay.
You know, like if you look through them, I'd say probably the most complicated ones might be on what type of services or healthcare are you looking for. But also, there's also a lot of those questions also have an other option. So if you don't know or understand, you can fill in another option on it.
Awesome.
But
I think it's
yeah,
amazing because we'll have actual data, which we can then talk about.
it will be great. And so everything has to be completed by the end of this fiscal year. So by June 30th, Health Resources in Action will have compiled all that data for us. And then we get to think about what we're going to do with it. So I think that's really exciting, especially I know that there's a bit of difference just looking at the information that went into it originally pre-February 2020, which it was kind of like with the last time it was really worked on. And then sort of now in I don't want to say post-COVID world, but in a new normal that we're in, just to see, where people's answers sort of lie kind of on that spectrum of how they're feeling. Because there's a lot of questions on mental health, not just your personal health, but also how you feel coping with if you're taking care of children or if you're taking care of adults or people with disabilities. So it'll be interesting to see what the outcome is on that. Yeah.
Did they do reference group, Tammy, HRA? Because it's going to be amazing. I'm so excited about it too, and having actual data to look at. But comparing us to other communities, right? Other communities in Massachusetts, other communities our size. It'd be really interesting if they have that to be able to say, this may be where people say they need work, but we're actually doing better than other communities our size, or compared to other communities our size in Massachusetts, we're, lacking in these areas. And so that maybe should be a focus for us. Do they have that? Do you know?
So they do stuff all over the country, but there are, if you look at, it's been a couple years since a couple different health needs assessments were done, like on the county and on Massachusetts as a whole. But there's definitely a lot of good information out there to kind of look where we are along sort of with others. I think just the nature of the community also, and like the age of the community, like you'll look and you'll see that, and I'm sure this will show it in the health needs assessment, that like a lot of your preventable diseases, like along the lines of heart disease and diabetes are up higher in our community than in some other communities. So it'll be interesting to see kind of how people respond on their perspective, not just on like data from, data that are reported from doctors' offices and whatnot. Just kind of interesting. And it exactly, I think depending on where you are, even in this county, like your access to healthcare is a lot different, here than it is, west of the river. If you're not anywhere near, say, Bay State Noble. So it'll be interesting to hear what people have to say. But I will forward you guys the flyer. If you guys have places you want to hand it out. And then the link is up on the website right now, but we'll put that in another email for you guys too.
And so that's any resident of East Long Meadow 18 and older?
Not necessarily, no.
Okay, so what would it be then?
There's a question that has age on it, and puts your age in a category.
No, but that's what I'm saying. It's open for anybody to take it themselves if they're 18 and older.
I don't think I have that. That's not a requirement that I've saw in any paperwork.
So children can take it?
It doesn't tie your information with it at all, like your name.
Is there a consent, or Katie's
Right,
thinking
because
the
we
exact
can't
same
do it
thing
under
I'm
18.
thinking?
Yeah, I'm literally was like, oh, we can't do that.
I didn't see anything anywhere.
Okay, we should look into that because under 18 is considered an at-risk population if we're doing a survey. And so we need to make sure there's a consent.
They'd have to have a parent or a guardian.
Mhm.
Right. So let's just see if I'm assuming it's 18 and older.
I didn't see that anywhere on anything. the survey and the survey and the prize are separate. They're two separate things. They're not connected. So I'm thinking that's why there's not an age range on it.
So you see, all three of us are kind of making a funny face. So the reason why, under the age of 18, they can't do it without parental consent. There's like much larger laws involved.
Let
with
me
that.
take a look then.
Okay, I just want to make sure we stipulate that. And if we are doing it under the age of 18, there has to be parental consent. Especially if this is
Let me look at the front. Let me look at the first thing.
There might be something on it, Tammy, that may be a clause or something fine print that I can't imagine not being. I've never heard of that.
Even though it's anonymized, it's considered research.
Okay.
This is like all three of our faces.
Right. Yeah.
I
And
just
you know,
want to
'cause
make
Katie
sure when
makes
we're
a good point.
advertising.
Yeah, we like also public advertising, right? And we don't want to be doing unsolicited research on minors because you're right, that's a very specific at-risk population. But then there'd be it would be good data too, right? Like,
Well, they're not adults. They're not
Yeah.
adults. So that's kind of, I think, kind of a flat thing, right? Yeah, they're not adults. They're children under 18.
I will pose this to Health Resources in Action tonight.
Thank you. And it's more also because we're collecting data on them, even though it's anonymous, but we're offering like a prize. So that technically can be considered coercion if they do not consent from their parent, have parental consent too. But thank you for clarifying. I think that will be helpful.
Yeah, I will make sure to ask. I would assume that the Health Resource in Action, they know their stuff. This is what they do. If this is a sort of
Did you say the link was live on our website already? Okay, I can try to find it and see what happens when I do it. Do I go to the Facebook or do I go to the Board of Health website?
I think we're
Probably easier to find it on Facebook,
Okay.
but it's on the website as well, under
Okay.
the news flash.
Got it. Take the survey. Just because I figured out, we'll read this.
would it be possible? I know that whatever graphic that is on the website, is it possible to make that link live on the website? Because I went to click on it and then like the next page rolled through. Alex, I don't know if that is right to be able to click on the link because it looks like it's a post of the poster that Tammy just had.
So if you click on the news flash section,
Yeah.
so if you click on the actual news flash, it'll bring you to the description, and on it has a live link.
Okay.
So it doesn't ask.
No.
I'm just seeing if it goes further, if it asks me later. Okay. And we can sort this out and you can ask them.
Yeah.
If there's some like stipulation or whatever, that's fine, but I just want to make sure we're. Yeah, it doesn't ask anything about age. Not that I mean, like, we might not have a large amount of children doing this, but I just think we should get clarification from them.
Right. And to bring up the coercion piece, we don't need somebody, I'm just thinking hypothetical, right? Like somebody assigning this to high schoolers as an assignment, if they don't want to participate, that's also something that's like not allowed to be able to do, to get tied to a grade or something like that, especially with a minor population. While it would be a great experience for some of our young people, like there's got to be pieces that are addressed to address those issues.
And collecting data is very regulated for that, anyone under the age of 18. Sorry, I just have to let my dog out or she's gonna start to bark.
All right. Sent a message to them so we can hurry up and get that in.
All right, well, we're all really excited, I think, for this project and can't wait to see the data.
Let's see, anything else? Um,
The last piece on your report, Tammy, if you're ready to move on, is the COVID piece.
good. Well, the numbers are looking really good. So for the last reporting period, I believe we had a total of 19 reported cases through the state. We had a lower amount of people getting tests, reportable tests. We had like 880. So we were at about 3.3%. I actually jumped ahead to what we'd see this week, and I want to say there was 13 total cases over the last 2 weeks for the next reporting period. Both reporting periods only had one pediatric case. I actually think they might be the same pediatric case because the weeks kind of move a lot. Since it's every 2 weeks reported, 2 weeks reported every 1 week, the rollover. So we haven't had much reporting on that end, and the school's been having, good luck with their program. They're not doing close contact or contact tracing because of it. So it's looking good that way. I know that there's a new way that Maven is reporting some data. Alex, you said that you were gonna present that tonight about the death reports.
Yeah.
Oh, you're on your.
Yeah. I sent it out to everybody though.
Oh, okay.
It's very interesting. The curves and the pandemic surges and the death rates are literally like a little staggered, but it's like whoop, 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 and it's every time there's a little surge in the numbers, the death rate goes up as well too.
Yeah, they've made it a lot easier to run reports on different tasks in Maven, which is great. And to see a lot of that information sort of side by side. Which, speaking of that, I can't remember if at the last meeting or if it was afterwards that I told you guys that Judy Goldrick, our public health nurse, resigned. So this week I set up some interviews for a couple candidates. So hopefully we'll be going through that. We'll find somebody good this week, and it'll be a little bit of a process, obviously, again, to have to go through and do the Maven training. But hopefully we're in the springtime and it's a little bit slower, so we're not really won't be bombarded with the contact tracing that poor Judy had while learning Maven in the winter time. I at some point would like to get in touch with all of you guys, because I'd like to give a certificate to Judy, because I know she was only with us for a short amount of time, but she really put in a lot of work and a lot of effort over the surge in the winter, just kind of recognizing her for what she's done. So once I get that up, I'll kind of arrange a time to get some signatures on it from you guys. Okay.
Yeah, I think, expressing our gratitude for all her hard work. Like you said, this was the worst surge we've ever had. So I think that would be wonderful.
Yeah. And I know, like, it was a hard decision, but like everybody else, she had more than one job, and it was just, it's a lot of work to take on. Let's see. So we also, last week, we had our COVID and flu clinic at the Fellowship Hall at the First Congregational Church. We had 10 people show up. It wasn't the biggest, but one was a booster, and the rest were all first or second dose series. So that's great that people are still kind of going forward and going with starting their series. Mostly children getting those. We will still be keeping with the second clinic on April 12th. I also was told at the end of the clinic that they were offering out $25 gift certificates for people who were getting their first dose. I wish that we would have known that before, so we could have put that in the flyer. Maybe it would have convinced some people to come in. So we'll be putting that on the flyer for the next one. Anything else COVID wise? I mean, it's nice that, that we're kind of transitioning to a health department, that's not all COVID all the time. We can start focusing on the new businesses opening up and everything like that. So that's, I'm keeping my fingers crossed. Let's see.
And I don't know if the CVS in East Long Meadow or the Walgreens has Paxlovid available. I know most of them across the county have that now, and some of them are even doing rapid testing. And if you test positive, they'll immediately give you a prescription for that, which dramatically reduces the severity of illness and risk of hospitalization and, death. So it's a really great thing to make sure we know that if people are testing positive, they can get that available at all the local pharmacies as well too. Because we are still seeing positives. That's the thing about the curve. Like you always will see the numbers going down, which is great, but there are still people testing positive. And I know people are really worried about the Omicron new variant that the Boston Globe just came out today saying that 50% of New England, that's what all of our cases are right now. So if people are, getting it again, getting treatment for them is really important as well too. And you can get reinfected, like that we know. But it's also just like how we treat everyone, so that way it's equitable, so people know that they don't have to even have a primary care physician. They can go to the pharmacies and get this as well too. If you don't have one, you should get one, but
there was also the clinic on February 28th. So that was in between our last meetings. That was at the Birchall Middle School. And there was 15 takers. So I don't know what was the difference between the first clinic, which had 51, and the second dose clinic only had 15. They didn't break down the first and second doses. They only broke down for me for that first clinic, the booster versus first dose series. So my guess is that most of those were probably second doses at the first clinic if they weren't coming back for the second one as much. Also, if anybody is in need of a test kit, we still have some left from our previous purchase. So, they can always call up and we can arrange a way to get a test kit for them.
You can order more now online too. The second round open up, so folks can go online and get the free ones as well.
As for vaccine data, not much has changed. We're still at 70% fully vaccinated and 39% boosted. We were really hoping that one person on last Tuesday got them tipped us over to the 40% boosted, but it hasn't yet. And then just Pfizer is now seeking an EUA for a second booster for 65 and up, and Moderna is seeking an EUA. Wait, that's wrong. Moderna is seeking an EUA. No, it is right. Okay. She's got it. You second guess yourself. Pfizer is seeking an EUA for 65 and up for a booster and a second booster. So that would be called the fourth one shot. And Moderna is seeking EUA for a second booster, but their EUA is only for emergency use authorization is only for 18 and up. So more information coming about that. Anything else anyone like to add COVID wise, or?
It was good to see the PEDS dose numbers though increased a lot over the last couple of reporting periods. So that was exciting to see in the data that y'all shared.
Yeah, I think that those are the doses that are going to increase our numbers at this point. I think there's uptake by the adult population, but it is very slow. So hopefully I'm trying to work with some of the other groups to push vaccination, before, with our camps, try to get make sure you're vaccinated, be healthy before you go into, camp season and whatnot. Just to us ways to get that information out. I know everybody's, it's, you know, it's like beating a dead horse that they vaccinate, but it is something that, you know, will keep the tides in our favor. So that's all. That was the three things on.
The only other thing I wanted to talk about is now that we are unmasking, we are seeing a dramatic rise in viral illnesses in general. So just keep, you know, hand hygiene. If you are sick, stay home. There was a stomach bug. There was viral upper respiratory tract. We're seeing flu A everywhere. So if you haven't gotten your flu shot, come to one of our clinics.
Yes.
You know, and it's just, I'm like, I liked not being sick. This is a whole new thing. Everyone's sick again. So just to be aware that the things that we haven't seen in 2 years, we are seeing again. And there was, you know, as an internal medicine doctor, I see mostly adults, but it's something that, you know, we are seeing it in children from my peds colleagues as well too. So kids are getting sick with other things as well.
And
Not
off
all
cycle,
COVID.
right? Like we're usually ending, like this is like the end of flu season and it feels like it's just kicking in. We're
Right, and
seeing
so
it in
if
the
you
younger
there's
population as well.
Yeah, and so if you look at the state data for flu A this year, like the graph started like this, everyone started masking again when Omicron, so it went to like almost 0. And the masks have come off and now it's going back up. Like I was admitting people to the hospital who had flu A, you know, so that's, you know, something I haven't had to do in a couple of years. So just being aware of that as well too. And you still should test for COVID, but there are other viral illnesses you could get tested for as well, either through your physician or through, you know, a advanced provider who you see, or the ER if you're that sick. They are able to do viral panels and expanded panels as well too. And do not just like take medicine and go to work. Like that's that's the other thing I'm like reteaching people. I'm like, just because it's not COVID and you have a fever, like don't just take medicine and go to work. So that's they're just, you know, relearning how to do measures to keep everyone else healthy too. In schools, work, by, you know, everyone's going back to their lives and I want that so much. So
Sick days are for being sick, not fishing trips.
right.
Exactly. Let's see. The other thing I just wanted to highlight that I have been working with our Medical Reserve Corps and our CERT team to kind of talk about what volunteership is going to look like in sort of our post-pandemic or new normal sort of world, because this has been the same sort of for any type of volunteer organization everywhere, not just East Long Meadow, that, you know, volunteer engagement wasn't very active for a lot of organizations throughout the pandemic, just because of the nature of the type of people that volunteer for the most part, especially in this pandemic. A lot of volunteers tend to be people who retire. They have free time on their hands, and they were sort of the last group that we wanted to send into situations like testing centers and clinics, or, you know, when they were asking for help at like the VNAs. But now that we know that there's a lot of people who have had interest, it's just that, you know, people haven't had trainings in person. You know, we've been pushing things on the virtual trainings on FEMA and on the train websites, but they're not, you know, they're not interesting. They're not that human to human interaction that most people get into volunteering for. So we're kind of working on a way to acknowledge the volunteers to boost engagement. And so hopefully in late spring, early summer, we can start bringing back trainings again. One of the ones that had popped through my email was as a pet CPR training, and I think that might be a nice way to kind of bring people back and maybe get some volunteers, since everybody loves pets. And then maybe getting the DART trailer as something to kind of show people kind of how you take care of pets in a sheltering situation. I think that would be kind of nice too. So I'm also working with all the county units to kind of as a way to reinvigorate the coordinators and team leaders of a lot of the units. I think everybody's just kind of, they've sort of burnt out. So we're trying to do like a a event where we reinvigorate training and kind of come up with ideas so that nobody's really reinventing the wheel, that we're all kind of playing upon what people are doing in all the different towns. Basically to get back to where we were pre-pandemic. East Long Meadow has always had a very active MRC, so I'm hoping to kind of maintain that going forward. So hopefully there'll be more stuff to come.
Jamie, I have a question. With everything that happened with the principal over at Birchland, there's all these initiatives with Timmy Strong about training people how to use AEDs and getting CPR training. Could that be one of the events we possibly consider doing for getting people CPR certified and knowing what that looks like and partnering with their group, especially because he is one of the principals in town?
I would love to bring back the You Are the Help Until Help Arrives series. And I think that's a great series. It's, when you look at it from the outside, like the first training in the series is basically how to call 911. And I know it sounds like, why would I need to know how to call 911? You need to know how to call 911 and to know when to call 911 and to know that you are a capable person. You can make the phone call. It's a great, I think it's a great way to kick off. So that's some of the things. And so following the You Are the Help, it's usually hands-only CPR and AED. And then what's the other one? Oh, Stop the Bleed is part of that series too. So that's something I'd like to get on a rotation going forward. And then maybe once we get things picked back up, to go do a full first aid CPR AED course for the volunteers. So it's because most people have not been active for so long. It's like, it's time to kind of remind everybody just the basic trainings, not just pets, but but yeah. If there are things that you guys would like to see or be part of, like, please let me know, because that there's been no shortage of people kind of wanting to come out and hold trainings and help out. So
The other one that might go along really well with that, it's a little bit longer and a little bit more intense, but mental health first aid, given everything we're seeing, I think would be a really, really important thing to do as well.
yeah, there used to be a regular psychological first aid course, and the person who does it now is in California. So that's something that the county will have to look around for. But it's a course geared specifically towards volunteers, like, because there are other psychological first aid courses, but this one was great because it was geared towards like what might happen in a shelter, what might happen during an emergency. But so hopefully we can find somebody to go around do that, because we used to do, and I know East Long Meadow, because I remember helping run it a couple of years ago, hosted it was an entire day. It was there was like an MRC 101, there was an ICS for volunteers, and then there was the psychological first aid. It was like an 8-hour day, but that was maybe like 4 or 5 years ago. But that's when the first time I had gone to the senior center, and I was like, this place is great. Little did I know. But yes, if you guys have ideas, please feel free, throw them my way. Or if some of you would like to offer some sort of training or your medical expertise, we would also love that as well. Because sometimes some of the best received, I don't want to call them trainings, but events that I've had were just people giving their experiences from the field during events and emergencies. So something to think about. Let's see.
Also, I know we have a farmer's market normally. When does that start too? I know it's at the senior center, or it used to be, I should say, pre-pandemic. Do we have that?
I went to Center Field last year.
Was it Centerfield last year? When is that starting? Just thinking about
I
like.
think it starts in June.
Okay. I love that.
It might be May, but I have to double check. It might be May through October, but
Who organizes that, Alex? Is it,
the rec department.
I was gonna say rec department.
Yep, yeah, it's their farmers market. They had it at Centerfield, and then they moved it to the high school parking lot when school wasn't in session. But no, they had a rework where they're gonna put it.
Thinking about how we can collaborate, maybe when it's a farmer's market, then we could do something like a health fair at the same time. That would be something that would be like doing blood pressure checks or like, things like that. That might be something fun to consider.
I just got an
The
email
National
back.
Night Out too, right? That's some point in the summer.
Yep.
That would be another great opportunity to do some ideas. That had a ton of people at it last year.
MRC booth opportunity. Definitely. I just got an email back from Amy Flynn from Health Resources in Action. She thanks us for the question. Because this is not a project that involves IRB/human subject research and is focused on community improvement planning and not research, there's no legal issue with collecting data from those under 18. In our work with online surveys, we include the intro language that the survey is voluntary, and then the individual can decide whether they want to take it or not. However, we can certainly move the age question up and make it an eligibility question and only get responses from those 18 years and older if that's preferred.
I have many thoughts. So I think, Christine, I have a lot of experience with surveys and I've done a lot with surveys in high school students, but what do you think, or Rebecca too, again, what do you all think about having that under the age of 18?
My concern is, being under 18, they're not considered an adult. I don't know. I'm just thinking of what they're going to put down or how they're going to interpret it. I don't know. I know surveys that we give out in school, they're geared for high school students.
Mhm.
And it's also in a language that is for their population. I don't know. I have mixed feelings on it.
Maybe
I tend to
take the check.
go, I tend to look at that. I'm always cautious.
Maybe take the survey tonight and then tomorrow let me know and then I can report back to Amy.
Yeah, I think I agree. Like, we're already discussing the health literacy of adults, right? I think you're going to be really challenged, I think much below the age of 16. I'm just using an arbitrary cutoff, right? To be able to answer the questions. I'm thinking about youth, and I have not taken the survey, obviously, but like access to medical care, that may not be something that a youth is actually even has an answer to because their parents still take care of it for them. I'm just throwing that out there as an example.
And and I work with kids in health assisting, so they're familiar with health terms. And I've got kids saying to me, "Miss, what does access mean?"
Mhm.
And that's not to downplay, but what do you mean by access? What do you mean by the resources? Give me examples. So, they won't understand maybe what the question is exactly asking for. I don't know.
And if one of the questions is maybe like youth access to healthcare in there, meaning like, what do we need? Then it would make sense for the parental or guardian teams to answer that, because like you said, they may not understand what the question means. And
No.
also they may not know how to answer that too. So, we'll take it all tonight and then we can give you kind of some feedback about just maybe we should just add the qualifier 18 and up. And that would be simple for them to add that too.
They actually Amy can parcel out only information if she wanted by getting rid of anything 18 and below 18.
I think from an ethical perspective, we have, even though it's not IRB driven, we're still collecting data on someone who has to consent to participate. Like, we have to consent when my kids watch movies in school. You know what I mean? Like, so to have them participate in a survey, my 11-year-old could go on to this, click the button and start doing it. You know what I mean? So, not that there's anything that we're collecting that I wouldn't want him to share, but it's just thinking about understanding and how we want to make sure our data is as accurate as possible. So that way we know what our community needs. And also thinking about like what Christine mentioned, that this is an at-risk population always. until they are considered a legal adult. Even if we're not having to go through an IRB and things like that, we are collecting data. And I kind of disagree with her response that we are using this for research. Like, we are using this data then to make changes to our community outreach and what we need for our community. That, in my mind, there's a question we're asking, we're changing our behaviors. That's considered research. And as a researcher, that's like when I fill out IRB exempt forms all the time. And that's the questions, you know, is there an at-risk population? Yes or no? Are you collecting the data? Yes or no? Are you using the data to make changes to your whatever? I just don't want us to get in trouble. That's the big thing. I just don't want it to come back and
It's
be
fair.
like,
It's
you
a
did
fair
this wrong."
question. Yeah, it's fair.
All right, well, yeah, tomorrow, let me know what you think after you take the survey, and then I will get back with Amy about it.
And it might just be as simple as, not using the age as the qualifier, right? So that she is able to stop the survey if you enter under 18. Obviously not going to stop someone from clicking the other button, but at that point, you do what you can do. But the other piece is maybe there's some language that can be added, right? Like, if you are responsible for children under the age of 18, please answer this, for your entire family unit. I think that might be a better way to do it.
Mhm. Sure.
And that it also is, I love that language, Christina. I think that really is more inclusive too. And also, anyone in the family can then answer it. It doesn't matter if you're, a foster parent or a grandparent who cares for children, or, just a family that's not a traditional, like, picture perfect family. You have the ability to be more inclusive.
There are
It also includes-
demographic specific questions in the survey
Oh,
Yeah.
cool.
to the person,
Okay.
to the person.
Yeah.
Good.
Yeah.
Well, that also allows for people who are responsible for kids, but maybe not full time, right? Like a grandparent taking care of kids after school until parents get off work, right? You may still have very important things about what you have to do with those kids. So, all right, we'll take it tonight and get back to you tomorrow. All right. Any other business?
Good.
Okay. The last thing on the agenda before we adjourn is to set next month's meeting. So,
I have next month from hell. Just so everyone is aware.
We also have spring break, so may want to stay away from that week for the public schools, just in case.
It's the only day I can do. Literally the entire month.
which day? Katie?
Which is it?
The 19th is the only day I can do. I have 2 conferences that I got accepted to that I'm going to, and 2 vacations. I had the 2 vacations planned first, and then the 2 conferences happened to fall in between. Oh, actually, I take that back. I could put, no, okay, I lied. I could maybe do the 26th, but it would be very kind of difficult. But I can try it if that's the only other day that works for people. But the 19th I could do.
I know
Wait,
it's
what are
school
the
break
days?
week.
Yeah.
I'm not going anywhere until later in that week, so I can do
I'm
the
not-
19th.
Yeah, I'm okay with the 19th as well. That does work. Yeah.
Does that work for everybody else? Okay. And Tammy, what day is, wait, no, Rebecca, your class is flexible now, so Tuesdays.
Yes. Yeah.
Okay,
So that'll be fine. Still asynchronous. Yeah.
okay.
Does 6 work for folks? Does that work for Tammy as well?
Yeah, Tuesdays are great because
Yeah.
there's nothing
Is it
going
the-
All
on.
right, our one day, we got it.
Although
All right,
that's I was gonna say there's probably not much going on because it's the vacation week. Yeah,
Yes. Yeah.
Easter Monday, and
Yeah. So that works. Thanks.
Perfect.
everybody wear bunny ears or something like that to the next.
All right, awesome.
Okay.
Okay.
Anything else?
Thank you,
Great.
ladies.
Then
for
do we
all
have a
the
motion to
thread.
adjourn the meeting?
I motion to adjourn the meeting.
I'll second that.
All right. Christine Johnston, aye. Katie Jobbins,
Aye.
and Rebecca Torsha.
Aye.
All right. Meeting is adjourned. Have a great
ladies.
evening, everyone.
Thank you. You as well, ladies. Take care.
Right.